Baltimore.
Mm-hmm.
The mayor announcing that Baltimore restaurants are going to resume limited in-person dining starting on Friday.
Yes.
And so Brandon Scott said that beginning at 6 a.m., a 50% capacity for outdoor dining and a 25% capacity for indoor dining with a 1 hour limit.
Okay.
So he said that the reopening of the outdoor dining and the limited indoor dining comes with the reminder that these are still locations where masking, one of the best ways to reduce the spread of coronavirus, cannot be maintained at all times, obviously because you be eating, but they're urging residents to continue to be cautious and provide up-to-date contact information to restaurants who will now be required to have contact sheets so the contact tracers can notify people quickly if an outbreak occurs. So what do you
you're
think
saying
about
with the
that?
contact sheet, Diamond K, they're going to come in as a guest. They're going to be given a contact sheet. They're going to write up their information. Who's going to keep handle on the contact sheets? Who's going to control that people are definitely going to adhere to the 50% capacity and 25% capacity? Who's going to adhere to making sure people are in and out in 1 hour? Are the restaurants going to modify their menus that people will only get food items that can definitely fit within the 1 hour time? Because and I know, we've sat in restaurants where it took almost 30 to 40 minutes for the food to come. Then we're going to have to swallow it, or we're going to have to take it out. I'm just saying. I'm just asking. What's going to happen here?
Yeah, that's true. That is true. I mean, this is going to be a work in progress, it's interesting. I have not seen it done quite like this, but that doesn't mean that we can't do it. So some of the other new mandates that are going to take effect on Friday: gym classes permitted, socially distanced with masks, and limited to 10 people. Indoor recreation sites, except adult entertainment and hookah and cigar lounges, can reopen at 25%. It was interesting that they singled out adult entertainment, hookah, and cigar lounges.
Because they don't have to wear masks.
Right.
So therefore, it's more likely for them to spread if they are in those type of environments. The people sit closer, and with hookah, they have those things, so they sit at a machine.
Right.
Not that they're using each other's, which they do.
Yeah, sometimes they probably do. Yeah.
But because they're so in close proximity, I could see them making that as a part of the restriction.
And so they're not totally leaving hookah and cigar lounges out. Hookah and cigar lounges can open retail sales at 25% capacity, but they must remain closed to on-site consumption. You got to get your hookah and go.
Right. Everything.
Get out of here. Yeah. Streaming of live performances will be permitted at entertainment venues. Outdoor gatherings remain at 25% limit, and indoor gatherings remain at the 10-person limit. Pretty strict guidelines here.
So they're going to be opening back some of the venues like Baltimore Stage and all of those places downtown, but at what capacity percentage?
So that part is a bit tricky, but they said that 10-person limit for indoor.
Wow.
I don't know what you can't do too much there.
I just know that when they did open before Baltimore Soundstage, and they had an event down there, and I went just to see what they were doing, how they literally were doing the social distance. Now, Diamond Cam, you know, honestly, it was set up really nice. I got pictures. It was nice. They had chairs set, you know, 2 chairs, you know, everything was spaced out phenomenally. Where my problem came is once, you know, people really got drinking and got to there, and they going up to the stage, and next thing you know, because they drinking, they ain't putting the mask right back up. It becomes an issue to me with that, with people being able to still adhere to the guidelines once they start drinking, once they get illegal. You know, they're not doing that. And then you don't have enough people on the floor who are working the venue to say, look, you know, put your mask up, do this. So then you find, like me, I ended up leaving because I started seeing the slack back. Because at that point, you're running up to the stage, y'all doing all this stuff, but nobody's adhering to the mask situation.
And that's one of the things. And the last time that I talked to the mayor, he was really trying to relay the point that once the alcohol came into picture, that sometimes the behavior was not, you know, where it should be, you know, based on people drinking.
Absolutely.
And so just to be clear, restaurants and bars can have outdoor service for 50% capacity.
It's cold, Diamond K. You know
exactly.
We don't do no cold
50%.
weather.
That's what,
you know we don't do no cold weather.
Well, we don't, but you never know.
We don't do that outdoor cold stuff like that. Like
we don't, but it's some
in the summer.
You know, so it depends on what your ethnicity is. You may be more comfortable eating outside in the wintertime. And then indoor dining, bars and restaurants is at 25%.
Right.
So then that 10-person limit is family gatherings, I suppose, you know, so that is kind of maybe confusing for people. So it depends on the size of your venue, obviously, and 25% indoor for restaurants and bars. And this is in Baltimore City. Do you think it's time for this? Is it too soon, or you think that it's about right? Numbers have been going down slightly.
I wish we would have been, this is just my view, I wish we would have been able to get more vaccines done with the venues. Like, I feel like restaurants are almost like medical personnel, because people want to go there, people want to eat in. So I felt like I wish we would have been able to get more vaccines and was able to get them to be vaccinated with the restaurants, just like they are with the medical personnel, because I believe you're putting people still at risk. You know, the restaurant is, are they really social distancing in the restaurant? Are they really doing their due diligence? That's the thing. Who's going to be going in these restaurants to make sure they're doing the 50%?
Well, I'm sure that they're going to be doing pop-ups on people. I'm sure that some folks that are concerned, like yourself, may report activity that's not up to par.
I stopped going to a restaurant. It was a carry-out. It wasn't even a sit-down, Diamond K. It was a carry-out right here on Bel Air Road that literally they were not wearing masks while they were cooking. I understand it gets hot, but you're supposed to wear the mask. I went in there, saw that one day, never went back.
So that's interesting. So you want folks to wear their mask while they're cooking the food, right? Is that what you're saying?
Yes.
Yeah.
If you have not, look, I don't know that you have been cleared that you don't have.
Yeah, I mean, but so let's say you go to Chick-fil-A. There's food's in the bag. You don't know.
Again, if I see somebody, it only takes me to see.
Now, the person at the window is passing you the food, they have a mask on, yes. But I'm saying the person that put them waffle fries in that bag,
you absolutely don't know. Right. I can't see them, so I can't speak on that. But if I happen to be in the restaurant that day, and I happen to be standing in line that day, Dr. K, and I see them in the back, you know, you can see back there sometime. You happen to see one in the back. Like, oh, I ain't coming back. Their mask. That's just right now until, I feel like once we get the vaccines moving, and I'm encouraging people to do it now that it's been.
Vaccine. Have you taken the vaccine?
I have not. I'm not.
That's right. Yeah, you're not in the. But you,
I'm not a
when
high
your
risk
time comes and your numbers called, you're taking the vaccine.
I do believe I'm going to do it. It's been enough taking it thus far, so I wouldn't want it. Like if I was my cousin, she's done it. She's already taken her first.
She's like
shot.
Okay.
Because she has to do the 2-part. She's in the medical.
Okay. So did she get the second shot yet?
No, she has not. One of my girlfriends did. One of my sorority sisters actually got her first shot yesterday. And I talked to her last night. She said she was feeling pretty good. She said, other than her arm being sore, I said, and that's kind of fast because when I think about when I get the flu shot, I get it on one day. It's normally about the second day, third day. That's when that arm start hurting. But she got it yesterday, and yesterday she said her arm began to hurt. So it's definitely a different type of type of thing. Because that's the first time I've ever known it to start paying anybody getting those kind of shots the same day. Normally,
I mean, if you think about it, an object is piercing your skin and then injecting something into your bloodstream. So when they talk about pain at the entry point, that makes sense because that to me that should be the only side effect that you get.
Right.
You're hurt at the point where the needle punctured your arm. That makes sense. Right. For that reason.
Have you received the shot yet?
I have not.
Are you going to get it? Are you going to get it?
I'm still waiting. I'm still observing. I suppose that I will at some point. I'm not ready yet. Okay. So I'm still observing, and I'm still watching people that I know that have had it, and checking on them. Are you good? Everything all right? And,
right. I'm with you on that. I feel like we should. I'm not big on it. Honestly, I never even used to get the flu shot. The only reason I started getting the flu shot was because when I started traveling internationally for my job, that was something that was a part of the process. It was like, it's really encouraged to do that because you are going in different environments, So that along with the other 100 shots you got to get when you travel overseas,
Right.
That was something that they kind of encouraged. So, I've been getting it. And honestly, Dominique, that was the first, 6 years ago was when I started getting the flu shot. And I must say, I really haven't been sick. Like I may get a little my allergies, even my allergies have been better. Like I'm a year-round allergy sufferer.
Mm-hmm.
I'm not saying that this flu shot did it, but I can say that I do. I'm not going to say the flu shot did it, but I'm going to say that I do feel, I know that I'm not a real sickly person, but if I get a cold, it takes me down real bad. But I have been truly not getting a lot of colds over this time. And I'm pretty happy about that. So, I'm just going to watch and see. As you said, you're watching those who I have several people that I know that are in the medical field, including my cousin who's already gotten the shot. So I'm watching them. They seem to be okay. So we're going to just watch. And when it's called, I am going to take it because what we do. We're out amongst the public. Coming some, strange folk sometimes. You just don't. So it's best for us I'd rather us play it safe than not.
Agreed. Definitely. And, we really want to get through this pandemic and get things as closely back to normal. As
not the new normal. Let's say that the new normal.
The new normal. Yeah, I mean, but that's what it's going. That's what it is. The new normal is normal now because we ain't going back. That's for sure. We're not going back. I definitely want to thank you, Michelle, for coming through.
Thank you. I appreciate this opportunity. I was shocked. I just was like, if he going over, I'm gonna hop him. But if you're not, then we just go.
No,
I
no.
was just gonna hop a ride with you, but this was even better. This opportunity to do this, and this was history in the making, and I'm just looking forward to us doing some more united things.
Absolutely, we need to do more.
As,
yeah. So,
us as in the media, but also what's going on in our world as at hand is that I hope that this is the turning point that other cultures and races see that we can be loved and we do love just the same. I believe we as a race love really hard. And
yeah.
So, I'm just looking forward to the new. That's all I can.
Yeah.
Looking forward to the new.
Yeah, I know. I agree totally. And this isn't the first time we've done this, and it's not going to be the last.
Absolutely.